We have a great lineup here, and I'm going to quickly fire at will, starting from Sebastian. Sebastian, you've helped treat patients at the highest level, okay? Let's talk a little bit how you've used that data and now how you're using AI to harness that data in injury prevention.
Yeah, I mean, we're using AI, generally speaking, in sports medicine in different fields. We're using AI for diagnostic purposes. We're using it, it helps us to interpret and assess X-rays. We get data, more data from MRIs, more than actually radiology. For instance, muscle volume or tendon cross-section area. We also use the AI in performance medicine, where we actually develop or design more personalized and precise training plans based on different kind of data sources, such as on-pitch data, sleep data, nutritional data, gym data, etc. And also we use AI in rehabilitation, where digital avatars are created to help us based on sensor data or optical systems with computer vision, where it helps digital athletes and digital avatars help us to be more precise when it comes to exercises. And of course, as you mentioned, the Holy Grail, which I call always the Holy Grail, which is injury prediction in order to actually prevent an injury. Yeah.
So you've mentioned AI, but can you, to the layman, make this more concrete? What exactly are you doing when it comes to injury prevention?
Yeah, that's a very, very good question. I mean, at this moment in time, let's be frank, there is no AI model existing as this moment in time which can accurately predict an injury in sports. And you know, or we both know as team physician, imagine how valuable that would be if that would exist. At the moment, it's not there, but we're working on it. And the question is, why hasn't it worked yet? And I think we need to dive really a bit more deeper into this topic, and then it comes down to what kind of injury are we talking, which sport, etc., etc. But if we look into it, and we look into football medicine, which was my field, then the biggest problem in football medicine is hamstring injuries. Okay, and hamstring injuries, they have doubled in the last 20 years. And that's the question, why is that the case? Is it just because of the game speed has increased, the crowded match calendar, overall demand? Or is it related to the data actually we collect? And if you would ask me, I think this is a very, very interesting point, because the data we collect is based on mainly muscle data. But if you look recently into the actually injuries, what happens on MRI, we see that the key injuries are actually tendon injuries. So we need to collect more tendon data, for instance. And maybe if you allow me one more sentence, at this moment in time, we have no methodology which helps us actually to tell us which player is at risk and which is not at risk. So developing such a methodology would be key to go into the key in the area of injury prediction.
But that's extremely interesting, because identifying those shortcomings is what is going to make you go over the next hump. I'm going to move over to Jonathan. Jonathan, you were one of the early adopters in robotic surgery. You've been a robotic surgeon since the early 2010s, and that's really early in orthopedics. Today, it's 2025. How do you see AI changing the game when robotics changed the game 15 years ago?
Thanks, Hassan. Robotics and AI are really closely linked. So it's amazing to see the improvements we've seen in robotics and AI over the last 15, 20 years. And it's even more exciting to see what we're going to predict for the future. So in robotics themselves, to use the robotic arm, we use AI algorithms to make the robotic arm movement more accurate. It identifies the positioning due to sensors, cameras. You can use all sorts of virtual reality as well when you're using the robotics. So we need that computational power to make the robotic arms run smoothly. In terms of patient selection or preoperative planning, the AI is really helpful in identifying information from CT scans. It allows us to predict exactly what size implants we're going to use. We can look at the balancing of the knee or the hip. We can also identify patient-specific characteristics that might make the operation harder, like deformity, their age, the bone quality, those kind of things. So even going forwards, there's so much data we can use that we are already collecting to improve the robotics and outcomes. But at the moment, we are able to use AI already to make huge difference in patient outcomes and care.
That's super exciting because we've already changed things with robotics. So I can only imagine what it's going to be like now that you're adding that added level of complexity and intelligence to the algorithm. Very quickly, I'm going to move to Shoaib. Shoaib, you've been involved in a startup where you're enhancing therapy after hand surgery so that you can improve the outcome. How has AI helped you change that?
Thanks, Hassan. Historically, or more recently, AI in hand surgery hasn't been as extensive as in other subspecialties in orthopedics. There are experimental works going on looking at AI to assess hand and wrist x-rays, for example, to pick up injuries such as fractures of the scaphoid, which can be missed in up to 15% of patients. Furthermore, conditions such as osteoarthritis or osteoporosis is being looked at. Can we look at metacarpal thickness, and can we, from that, work out whether patients are more likely to get osteoporosis? You mentioned about the therapy, which is a specific interest of mine. We're looking at computer vision technology and real motion tracking technology to allow patients to undertake hand therapy from the comfort of their own home, because there are issues sometimes with accessibility, with compliance, and allowing patients to undertake hand therapy will ultimately improve their hand outcomes and reduce inequalities.
Reduce inequalities, I love that. So how exactly can AI reduce inequalities when it comes to the delivery of orthopedic care and specifically hand care?
I think health inequalities is a reality throughout many health systems around the world. We have a time now where we can use AI to bridge these inequalities. However, as we know, the processes and the algorithms are only as good as the data that is input into them. So it's very important for those who are leading and for those who are stakeholders to ensure that the end user, the patient, is taken into account. Their background, socioeconomic factors, their geographical locations are taken into account when designing these AI algorithms to help deliver better healthcare. We need to have ethical standards and regulations, and we need to have the approach to be human-centric. AI is supposed to be there to help the patient and help the doctor, not replace the doctor. I think that will lead to ultimately better outcomes, and this is what we require from AI.
Do you see it being applied anytime soon within your practice?
Definitely the project that I'm working on, I think within 12 to 18 months, it could be coming to fruition, hopefully.
That's amazing. So Jonathan, you were involved in developing some of the robotic implants that we have right now. Being partly an engineer, partly a physician, you wear a different hat every day. How do you see the current technology, current AI technology that we have helping you in this design process?
Yeah, implant design is a really exciting field if you're an engineer like me. It's really important that we have a good, safe outcome for our patients if we design a new implant. And these implants go through lots of testing. So the testing is over a long period of time. Often we're following up these patients for 10, 20 years. So with AI, we can look at large data sets, and we can predict using computer models much more quickly and accurately. So if we have a design, we can put it through a data model. We can choose specifically, for instance, if patients have osteoporosis, how an implant might function in osteoporosis. If they're a particularly heavy patient or patients who do a lot of activity, we can run through the finite element analysis and run through the computer models, and we can really reduce the time taken for the design. We can also look at data that we already have. The joint registries internationally, British Joint Registry already has over 1 million patients in. By going through this data, we can work out what type of designs work well, what types of designs work less well. We can use through AI early prediction of implants if they're failing, so we can pick any faults or failures up much more quickly. And there's in the future, we're looking at how we can design implants for specific types of individuals. And by doing that, we can also work on new materials and work out how we can test new materials virtually before putting them in patients. So we can design the implants quicker, get them into manufacturing quicker, and it's safer for the patients.
Do you think it's going to replace the engineers? Do you think AI will replace the engineers?
No. I think we need the engineers, but I think I think we should see AI as a tool to facilitate our practice, to help us rather than to mean that we don't need those experts. I think that we will still need engineers, and we might need less, but I think we can explore whole new avenues that we've not been able to do before. And the most important thing is the right thing for the patients.
That's amazing. So, Sebastian, do you think it will replace the head team physicians?
I don't think so. I don't see that coming yet. I think it still needs some time that AI really replaces. I think it will be always a situation where it supports, it will help, it will aid you in decision making, but I don't see it coming yet that it fully replaces it. However, over time, every model will learn, and we never know what the future will bring. But at this moment in time, we're not there yet, at least in the world of injury prediction.
So, having been a head team physician myself at one point, the demands at that level are extremely high. And the level of education also at that level, and the level of second, third, fifth, infinite opinions is also high. When you have an AI algorithm to add to that, what do you rely on? How do you communicate with those patients/players?
That is a very, very, very good question. I mean, at the end of the day, there is this part of predicting an injury, but then you actually need to act on it in order to prevent it. And that raises the question, what are you going to do with what an AI model tells you, for instance? Are you fully rely on it? But just give you an example. If a model tells you this player is at 80% risk for a hamstring injury, are you allowing this player to play in the Champions League final, yes or no? Who makes that decision? So there's a lot of things which are not clear yet, and it's going to be very exciting to see how this going to influence decision making. And I mean, we know both head physician and managers actually. If you think one or two top managers, how they respond if you as a team physician tell them this player should not play because he is at risk for an ACL injury or so. It's exciting, and let's see what the future brings here.
Absolutely. So we've used this stage as a department to promise and deliver in the past. In 2022, we sat on this stage and we promised a world-class orthopedics department here in the UAE. 2023, we delivered on that promise. 2023, we promised a day surgery center in Dubai, and 2024 we had delivered on that promise. 2024 we promised a scoliosis service that will serve both the UAE and the regional population. We delivered. You have the best stage in the world to promise something that's AI related in orthopedics. What are you going to promise this audience that we're going to deliver on next year? Shoaib.
I think for me, having better hand therapy access and better outcomes as a result is something that I would like to promise. And I think if we can get AI involved where patients are actually undertaking hand therapy exercises and improving the outcomes, and that's going to be better overall for everyone.
Can you be more pragmatic?
I think we're looking at probably, like I said, 12 to 18 months in terms of getting that out and getting patients involved. on an AI-based therapy app.
Jonathan.
I'm 100% behind AI, and I can already see the huge changes and benefits personally in my practice in working at Healthpoint. And I can promise that next year I'll be using AI for sharing information with patients. We can share specific, personalized information on their condition, risks about their surgery, specifically for them rather than generic. We're using AI, and we will be using it more in our note keeping, our records. And in terms of robotics, we're very close to using AI to guide the surgeon. So when I'm doing an operation a certain way, I would expect the software to be telling me, if you use this approach, it will be less effective than using another approach. So I'll be listening to the computer and the AI to tell me from the database that it has, which way is the best way to do the operation for that patient. And I think that we can achieve that.
Jonathan, you touched on something great, which is note keeping and sharing information with patients. You're already part of the M42 project, which you've seen through its infancy, and you're helping our engineers and physicians design it. Anything that you'd like to further comment on that?
Well, it's a really, Med42 is a really good system, and I use one of the operations I do, which is hip arthroscopy. It's very specialized. The outcomes, if you have a revision surgery for it, it's quite difficult to explain to a patient that if you have another operation, the outcomes are not that good. So you can put it through the system, and it will give you a summary of the patient, of the literature. It can really summarize to the patient exactly what they might expect. We can give it in written notation, and then it can go into your notes and your dictation to show that you've fully been through the consent process and had a two-way conversation with the patient. And that makes me feel better about proceeding with surgery. And I think educating the patients and allowing them to be part of the decision-making is really important.
Amazing. Sebastian, your turn before we open it up to the audience.
I think to promise that we will be able in 1 year to predict accurately hamstring injuries is probably too advanced. But what I definitely believe is that we can build the infrastructure, the data infrastructure, the data center. With all our collaboration we have at Healthpoint with the local football clubs, we will be able to collect a lot of data, relevant data, which then allows us to develop the methodology which I mentioned before, which is not existing, to give us accurate data. So I think that's what we will do in the next year, to build the infrastructure to be able to do that.
I love this. You know why? Because what you just touched upon with data is what Time called the career of the decade back in the 2000s, a data analyst. Today, that data analyst is a prompt engineer, and this is exactly what you are doing today. Thank you. Gentlemen, thank you so much. We're going to open it right now to the crowd for any questions.
Hello, thank you so much for this interesting discussion. I'm Dr. Mohammed Shoaib, expert in health communication. So my question is related to equity. I think you remember when the coronavirus emerged, at the time we talked about access to vaccine. So today, Dubai is very developed, and like the UAE, it's occupied with like the last advancement and achievement related to the AI and technology in general. So do you think that the other countries in the MENA region, and let's say MENA region, including African countries, do you think with like at the same time with Trump, he said like he's not recognizing today the role of WHO. Who is going to help today the other country who don't have access to this like technology?
Shoaib, I think you're very well poised to take that question for us.
Thank you. I think it's the responsibility of everyone, actually. Every individual is responsible at some level to ensure that AI is developed, taking into account all patients from every socioeconomic background and geographical location. It has to be step by step. It's not going to just happen like this. You have to get the technology to be working correctly, and then you've got to build on that. It's all about engagement, consultation, and discussion with all stakeholders, and that's how we're eventually going to allow the technology to be used all around the world.
Amazing. One question there. Last question. And if you can just introduce yourself as well, please.
Yeah, hello, my name is Kamran Sharif from Nash Bio. So a question actually for Dr. Kunz. I was fascinated by your background. I'm a big Premier League fan myself. One of the questions I've got, whether it's prediction, AI-enabled prediction of ACLs or hamstring injuries, the more data that feeds the algorithm, the better. Now, do you see a world where all of the Premier League clubs are going to share their data to optimize the algorithm? Because I can imagine that Chelsea, Arsenal, Spurs, Man United, they're going to all want to keep their data themselves for competitive reasons.
This is a very, very good question. The answer is, I don't know. However, I do think that, yes, you're right. In Premier League clubs, it's always about privacy. And generally, the question of who owns the data needs still to be answered. But I think if we want to go towards that goal, we need a lot of data. And that means probably the best way would be to connect everyone and do it on an association level, even on FIFA level. Okay, so to get more and more data from many multiple. And that will, at the end of the day, help everyone, not only the clubs themselves, but mainly also the athletes. So I think, yes, on association level is probably the best way to do it. Yeah.
Absolutely. Actually, in the US right now, the NFL is collecting data on all of their patients. And they have wearables on every single patient during training, as well as in competitive play. All right. Very well. So we'll field the last question because we don't want to run over time. Please.
Okay. Hello, everyone. I'm Dr. Nadira. I am from BioAro and Longevity Clinic. So actually, we're also working about longevity and technology and about like all this because this is the future now. People they don't want to get sick anymore. So it's about the preventive medicine. So actually, there is something also like I just want to ask or I just want to mention. It's something like we don't only want to work with technology and everything. We want the patient, like if patient come to here in Dubai, okay? And he come like to our clinic, which is very technology, which is very advanced, and he have all the tests. Then he was in France, or if he was in London, or something happened to him, and he don't want to do another test, or people like, you know, in this clinic or in this hospital, they don't know what the patient have. Because he already was with us, with the advance and with the technology. So why he should to do it all again or whatever. So actually now like there's something we are working about. It's about the blockchain, but in the healthcare industry, you know? So we want to connect all the data for with many hospitals, with many clinics that we have. So I just want to know if this can be like possible or this is good for the future. So
Dr. Nadia, you've actually touched... sorry? Nadira, sorry, I apologize.
It's okay.
Dr. Nadira, you've touched on something which is very dear to our heart. In Abu Dhabi, we are the champions of Malafi, and it has connected the data amongst all healthcare providers in Abu Dhabi.
I know.
And the goal is to hopefully be able to transition that beyond the state. Obviously, it requires a lot of commitment from several key stakeholders, be it the insurance providers, the government and regulatory bodies, as well as the healthcare providers. But it's very interesting to see where you guys are heading because you face it on a day-to-day basis, whereas now we are moving beyond that.
Yeah.
Thank you so much.
Thank you so much.
Thanks. And without further ado, I'd like to thank my panelists. Couldn't have been better without you guys. Thank you so much.